All right, so today I'll be giving you an overview about a lot of models that I've worked on, past, present models, and future ongoing projects that I'm working on with a lot of people from everywhere. Last time when I gave a talk about this, it was a very short talk, and I just gave you a lot of bad news. This time you're really going to find out why it's so bad, actually. So I'm just going to talk about some dengue fever modeling and some of the challenges that public health officials face and how we can address them in the future, and some of the new stuff that is going on in places like Peru, Puerto Rico, and Singapore, Costa Rica, and so on and so forth. So this slide, I haven't updated it, but this was like a month ago. So this is like the last 3 months from a month ago. Where the dengue distribution, mostly on the tropics. And I'll be giving you a detailed example about this little place right here, Puerto Rico. Oops, that doesn't work. Okay.
A quick
There
question
you go.
before
Yes.
you go on.
Yes.
Sorry. You've been working on dengue for quite a while. Do they have an updated map from, not an updated map, a map from maybe like 5 years ago or 10 years ago when you started working on this?
Yes, I actually have that map.
You do have that map?
Yes.
Okay.
Yes.
It'd be interesting to sort of contrast what it's been over the last 10 years or whatever it's been.
Yes, I think it looks similar, but yeah, that would be good to see how it has maybe shifted more towards, this way, or, in Puerto Rico, this has been dengue for a long time. But yes, I have that map actually.
Okay.
So some particulars of dengue. I think there's a few of us here that have worked on dengue. So it's transmitted by mosquito. Aedes aegypti is the main vector. Aedes albopictus is the secondary vector. That is mainly in rural areas. Urban areas. The Aedes aegypti is mostly in the rural area where humans live, and they have adapted very well to live within humans. They're not a very dense population of mosquitoes. Females are the only ones that bite because they need the blood meal to be able to reproduce, lay their eggs, and all that stuff. They do also feed on nectars, just as males do, but they prefer humans as, just to get the blood that they need to lay their eggs and stuff. There are 4 different serotypes of dengue, 1 through 4, with some subtypes in between all of those. Dengue 2 in particular has been sort of blamed for causing the severe case of dengue, which is dengue hemorrhagic fever, or shock syndrome. It affects primarily people with weak immune systems, so the very young or the very old. So people with those kind of immune systems, if you get that severe case of dengue, you can die. The death rate is not particularly high, but it's important to kind of talk about this because the socioeconomic impact it has in these countries is huge. People stop going to work because they're sick. They don't go to school, so the parents have to stay home to take care of the kids if they're sick. If you get the severe form of dengue, you go to the hospitals, and then you're in the hospital for a couple days, and you can actually die. So the manifestation is just you pretty much bleed to death if you get to that point. There's permanent immunity to each strain, but no cross-immunity to others. There is some debate as to whether there is some partial cross-immunity. Right after you get one, you might not get the other one, but it's not clear yet. It affects a lot of people throughout the year, and we've all heard this before. So it's believed to have been transferred from monkeys to humans anywhere between 100 and 800 years ago. So it's been around for a while. Each region that is endemic with dengue has pretty much strain I, but it might not have all the variants. Like for example, recently in Peru, they had this dengue 2 Asian, the Asian type, which caused a big outbreak in Peru and many hemorrhagic cases. And you can argue that is it the most important vector-borne disease? Well, malaria kills a lot of people, but malaria is very concentrated in just one continent, and it does affect a lot of people. But just as dengue might not kill that many people, it affects many more people in the world, and the impact, the socioeconomic impact, might be larger than malaria, or at least equal to malaria. So the hemorrhagic fever, so that's the most severe case of dengue. There's a definition by the WHO that says, if you have fever, lasting 2 to 7 days, any hemorrhagic manifestations, the thrombocytopenia, which is just your platelet count, less than 100,000 microliters per microliter of blood. The normal is about 150,000 to 450,000 microliter of blood. So it's really bad, and this is from the public health website in Puerto Rico. So this is, well, they get this from the CDC. So what to look for when you are evaluating somebody that might have, dengue hemorrhagic fever? Well, bleeding, and they're usually very weak and all that stuff, and they send them to the hospital right away. But do they know right away that it's dengue hemorrhagic fever? Because most of these cases, one, they're asymptomatic, and if you do start with a severe form of dengue, most likely everybody's going to tell you that you have the flu. Until they finally realize that you start bleeding to death, they'll be like, oh, it might not be the flu. It might be something else. And most likely, if it's in Puerto Rico, it's probably going to be dengue. Just because it's known that it's endemic there, and every time dengue comes around, the TV commercials are endless, the newspaper articles are endless, so everybody knows that it's around. People still don't do anything about it. Some people might be more aware than others. They see mosquitoes, they start wearing off or something like some repellents, but they will not do anything to change the where they live, like screens. I don't know anybody in Puerto Rico that has screens in their windows.
Yes.
Well, I said I don't know, but I'm sure there are people. I don't know. In the city where I live, nobody puts screens on their windows. My mom, we live right next to a lagoon, so standing water, and there are no screens in our windows. I'm sure there are, but it's rare to see screens on windows in Puerto Rico. Maybe in other counties where I'm from, kind of east, northeast coast, they don't usually have screens. Well, at least I haven't seen any. So the vectors, Aedes aegypti, Aedes albopictus. The tiger mosquito, the Asian mosquito, that's Aedes albopictus. It's very aggressive. However, you rarely found them in rural areas. The Aedes aegypti feeds primarily in humans. That's the main vector for dengue fever. And there's a little song that I'm going to play, so you can. Hopefully, it's not very loud.
It's going to be unbelievably loud.
There you go. By the way, I only have what is it? We have to end at 3 because there's a prospectus offense. But this is my one. I think my 5th slide. I only have 201, so we're good.
You're not going to sing us the song?
I don't remember it. It went something like, where you can hear 2 mosquitoes kind of,
Dancing?
playing. Yes, that too. And now I lost the thingy again. Okay.
Just click anywhere.
There you go.
You pushing you, Fabio?
Yes. We don't need the song. Hopefully the other part will work. There you go. So this graph from the CDC, I'm sure you've seen it before from either David or Susan. It's transmission cycle of the mosquito. The mosquito needs to bite an infected person, and there's a debate: like, how many times does a mosquito bite before you actually get the virus? It could be 1, 2, 3. Nobody really knows, but it could be from the first time, or second time, or third time. Point is that the mosquito is probably going to be where you are, so it'll find you. If it didn't get you the first time, it'll get you the second time. So they usually stay where they actually find food, in this case, humans. Some data, most of the cases are asymptomatic, so you might feel like you have a cold or something like that, and a couple days later you'll feel fine, and you never knew that you had dengue. That seems like, oh, that's okay, then that's not a big deal. However, there's some evidence that there's some cross-reaction with some other strains where you can actually get the severe form of dengue, which is the hemorrhagic case. And then it's not going to be so much fun the second time around. If you had one strain and then you cross-react with another one, it might be really bad. So that's why these asymptomatic cases are important. That's one reason. The other reason is you might have a year where there are a lot of asymptomatic cases, and then that one strain is around, dengue 1 is around, and it's mostly asymptomatic. Then the next year, everybody's immune to strain 1, but maybe strain 2 is introduced from somebody that came from Singapore, and especially the Asian side, and it's going to cause probably a major outbreak and probably a lot of hemorrhagic cases. Because dengue 2 has been blamed to be the one that cross-reacts with any other strain to cause a hemorrhagic case. So there are a lot of little details about dengue that are quite important and that we're not really sure about 100%. There's some evidence about a lot of things, but we're not really sure, especially what to do. Do we kill the mosquitoes? That's not possible. Do we get rid of all the breeding sites? Not possible. Now, if we reduce the density of mosquitoes, does that help? It has been shown, Googler showed that in 1980 something, that low mosquito density has no effect on large outbreaks. So you can have large outbreaks with low density of mosquitoes. I did a model with Carlos, Martin Eggman, and Professor Harrington that showed the same thing using a function that supported multiple demographic equilibrium. And we looked at the outbreaks, and they were very similar. So low versus high density didn't really make that much of a difference. Now, this is some data that I showed last time from Singapore from 2001 to 2006. Last time I mentioned they have great healthcare, public health. Right? They really take care of, they try to take care of the breeding sites. They have spraying campaigns. They have education. The people know. And that country is ruled by a king, I believe, and they're very strict about everything, and everything seems to work perfectly. Well, it was. They had not changed anything that they had done, and it's still, I did it again. And in 2006, 2005, 2006, they kept getting more and more cases of dengue. But they have not changed anything before. But I believe, I was having a conversation with Shad a couple of days ago over dinner, and we were talking about this particular behavior and say, well, what is going on? And he said, well, sometimes we're too good for our own good. Sometimes you might not want to do that good of a job because what you're doing is creating a bigger pool of susceptibles for when the next strain comes in from one of the bordering countries, Malaysia or one of those countries in Singapore. Now you're going to have a huge outbreak. Right? So what is it that you want to do? And I'm going to talk in more detail about that later. But this is data from Peru from 2000 and 2010. And this is from Puerto Rico from 2007 to now 2011. Now, this outbreak here in 2000 was caused by dengue 2 type Asian. They had not had dengue in like 20 years. Dengue 2 was introduced, the Asian type, and they had over 10,000 cases. And a lot of hemorrhagic cases. Recently, now in 2011, it's not here, that data is not here, but 2011, dengue 2 Asian came back again. And they have more cases than they had in 2000. And I'm going to show you what strain, I think I have it here. So there's going to be a couple of strains that were responsible for that outbreak, and then a couple of different strains that were responsible for that outbreak. And then everything in the middle, there was kind of everything going in between, like a little bit of everything. But there was a lot of immunity in the population, so there was nothing really taken off. Now, is that really what we want, actually? Is this what we want? Probably, right? We want to keep it around as some sort of artificial vaccine or herd vaccination. So we want actually to keep the 4 strains of dengue around to a certain level, so we don't get this, which has a huge impact on the socioeconomic, socioeconomic impact and people not going to work and hemorrhagic cases and things like that. And there was, yes. Gerardo gave me this reference, I think yesterday, by Johansson et al. 2009, the correlation between temperature and precipitation using data of the last 20 years. Now, that's a little tricky because is there really a correlation there? I mean, in Puerto Rico, I found some data where temperature doesn't really fluctuate that much. It's pretty constant. So is there really a correlation, or it's constant most of the time? Precipitation, well, it depends on the year, right? There are some years, actually the biggest outbreak, well, this is what I was talking about. Let it be, right? Just let things just have the strains kind of roaming around there, and that might actually be the best strategy. But how do you make a TV commercial and say, well, we're going to actually introduce all 4 strains of dengue